Hello everyone, I am Lyan C. Baril and this is me, your student nurse from Visayas State University. So I am here demonstrating the preparing about the medication from the ampules and then how do we get on it. So before with that, I have here the on how to assess the medications from the ampule. So first is that we are going to determine the client allergies to the medication, and the next is there is any specific drug action or some side effects, and then like interactions and then some adverse reactions on the client. Next is we are going to determine the client's knowledge and the learning that we needs about the medication. The next is how do we intend the route to the parenteral medication to determine appropriate size of the syringe, just like this. So I'm going to determine first the assessment before we proceed to the equipment. Next is we are going to appropriate the size of syringe and then also the needle for the client. Next is the ordered medication for the clarity and the expiration date of the ampules that we have. Next is to perform appropriate assessment, the vital signs, laboratory results, specific medication that we have. And then next is to determine the assessment data that is influence administration of the medication, like and appropriate to the administer the medication of the dose and medication that are need to be held or the primary care of the provider. So now we are going to proceed to the equipments that we have. So specifically on the equipments that we have, the very important thing is the ampules that we have. This is an paracetamol ampules. So the expiration date on this is by August 2023. We have here the syringe, which is important thing is the disposable syringe and then another syringe and then some precision needle syringe. And then next is we are going to have some gauze. But for this video, I have no gauze because in here and bye-bye there are no gauze. So I'm gonna use some cottons that we have and also to clean the ampules. And then also the sanitizers for us. And then next is the clean gloves, the pair of clean gloves. And the very important thing, because we are not going to administer medication for for the humans, we have here some chicken so that after preparing and then some routing of the ampules, I have here to tutusok ko yung injection dito sa manok natin. So now we are going now to proceed the implementation or the and how to assess the medication for the ampules. Alright, so how do we perform or withdrawing the ampules or the paracetamol of our patient? So first things first is that we are going to perform the hand hygiene and then observe other appropriate infection or prevention and of the procedures. So I have here the sanitizers and I'm gonna put some on it. The next is we are now going to prepare the medication ampule for the drug withdrawal, and then which is we are going to flick the upper stem of the ampule. So which is the upper stem? So this is the upper stem of the ampule. So if namoy makita nga bubbles nga diri sa ibabaw, which means kailangan po nato siya i-kuan diri. So for example, lagyan natin ng bubbles. Then just like that, nga i-kuan na siya para kailangan sa ubos. Because kailangan nga na siya sa ubos kaya ato man gud siya i-tanggal ang stem, which is the upper stem of the ampules. So next is that by flicking the upper stem of the ampules, we need to use the ampules opener or some place or piece of sterile gauze. So wala man tay sterile gauze, so I have here some cottons nga mag-place lang siya or as an alternative as a sterile gauze. So and then before with that, limpyuhan sa nato ang iyang neck. So, just like that. Limpyuhan lang nato ang neck. And then after that is that we are going now to flick the ampule. So by flicking the ampule, we are going to wipe just like this. And then between your thumb and the ampule neck or around the ampule neck, we're gonna break off to the top by bending it toward you to ensure the ampule that are broken away from yourself and away from the other. So, ato ni buakon ang ibabaan. So, that's it. So, that's it. So that's this one. Now, we're going to proceed on withdrawing the ampule. So, asa ni nato ilabog ang kuan. So, ilabog ni nato and then we are going to place it on the some mga basura nga, mga sharp edges din. Alright, so now I am done withdrawing the So, I'm done taking the neck of our patient. So, now we are going to withdraw the medication of our patient. So, first is we need to place the ampule on a flat surface. So, diriya lang nato siya ikuan. And then, attach some filter or needle straw. So, I have no filtered or needle straw. So, I'm going now to insert na lang the needle as a center of the ampule. Bali, diretso lang ko mag-withdraw na lang. Kay wala ko'y filter needle nga. Very important thing as an equipment on it. So, I'm gonna open now the needle. And then I am now going to withdraw. So with a single dose of the ampule, we are going to hold the ampule slightly on each side, which is here. And then it is necessary to obtain more than the ordered amount of the medication. Then dispose the filtered needle by placing on a sharp container after that. So for example, we are going to assume nga kanang nanay filtered needle. I am done preparing the filtered needle. So after that, I'm going to dispose it to the sharp container, like I disposed the neck of the ampule of our paracetamol. Then next is we are now going to give the injection that's replaced on a filter needle. So muna siya, and then I'm here. So put na nina ako na ikuan kay mag-withdraw na ko. So by withdrawing ako or siya ana, and then then after that, and monitoration time that we are now going to push some solution to the needle and then prescribe amount. So nadiri ang makita natin. Nara siya sa 2. Hindi siya kaya makaro kay. Yes naman inakot nga ako. Then that is the time that we are now going to put the insert the needle into our chicken, the skin of our chicken. So alright, I am done. For example, I'm just assuming that I am done injecting or inserting the needle to our patient, which is assuming that here it is, the chicken. So now I'm going to place this cup of the needle and then put it in a sharp container, right? Then next, and then the body of the ampules also put in the sharp container. And after that, I'm gonna hand sanitize for the infection and that. So that's it for withdrawing and administering the ampules of our patient. So thank you and God bless.